Do you want to become a doctor? Oh, are you curious about how some people become doctors? If so, this video is going to be for you. I will be explaining about every single step that you will have to go through if you want to become a doctor in any country. By the way, I'm Roshen Akthar, fourth year medical student, University of Colombo. The process of becoming a doctor starts with the pre-medical studies. So here you are going to be studying the sciences that are going to be necessary to understand the concepts in medicine. It's known as advanced level in some countries like Sri Lanka, or senior secondary education in some other countries, and some people also call it as college education. Here you will be learning the core sciences, which are biology, chemistry, and physics. It usually takes 2.5 to 3 years. In the process of becoming a doctor, this period is going to be relatively easier, but you will have to keep your scores up because in most of the countries, becoming a doctor is a super competitive thing. So that your academic performance is going to play a vital role in getting selected into a medical school. In some countries like Sri Lanka, at the end of these pre-medical studies, you will have to sit for a general examination. This will be a competitive examination, and when they release the results, there will be a ranking. So according to the ranking, when you apply to a medical school, they will be selecting you according to your academic performance. The second stage in the process of becoming a doctor is medical schools. So this process is going to be a little bit harder than the pre-medical studies, and I'm currently in it. The duration of medical school is mostly 4 to 5 years in most of the countries. This is a process of transforming a normal student into a highly professional, confident, and high quality doctor who can literally save lives. So this is going to involve a lot of training and practice. So that's why it's relatively harder than the pre-medical studies. The curriculum that is studied in a medical school can differ according to the country, according to the university policies, etc. But I will be giving an overview about what you will be studying in the medical school. As we all know, a doctor treats diseases. So a doctor should be capable of differentiating the normal things from abnormal things. So you will be spending one whole year in studying the normal structure and functions of the human body. This is studied under 3 main subjects, namely anatomy, physiology, and biochemistry. In anatomy, you will be studying about the structure of the body. It has several branches such as macroscopic anatomy, microscopic anatomy, which is also known as histology, and you will be studying a little bit of embryology also. In physiology, you will be studying about the functions of the human body, that is, the normal functions of the human body, and biochemistry is about the biochemical processes happening inside a human cell. These 3 subjects are also known as basic medical sciences, or in some universities they call it Preclinical Studies. At the end of this, you will probably have to face a Berry exam. And this is going to be challenging because if you don't pass this exam, you will not be going to the second year. If you fail this exam, you will have a second chance, which is called the repeat exams. If you fail that also, you will have to join the junior batch. After this basic sciences stream, you will go to the applied sciences stream. This is where you are going to start learning about the diseases. What causes the diseases? What are the mechanisms responsible for the signs and symptoms of the diseases? And how can we alter these mechanisms? And how can we use the medications to alter these mechanisms? All these questions will be answered for most of the main diseases at this point. These are studied under 4 main subjects: pathology, which is about the diseases, the mechanisms of signs and symptoms, the impacts of the diseases, which are basically the complications of the diseases, and you will also study the microscopic changes and macroscopic changes that occur during a disease process. Pharmacology is about the medications, parasitology is about the parasites, and then comes the microbiology, which is about the microorganisms. In addition to these subjects, in these 2 couple of years, you will be learning forensic medicine also. And there is community medicine, in which you will learn about the public health. So this is all about the preventive health. You learn about statistics, epidemiology, and demographic stuffs and all those things. You are going to love this subject. This is very interesting, and you will realize that once you get into a medical school and start studying community medicine. At the same time, while all these theory stuffs are being learned, you will be starting new phase of your life, which is the clinical rotation. This is where you start to interact with your patients. You will be assigned to different wards to do clinical appointments under the supervision of consultants. This is going to be relatively difficult than the academic stuff because people are not going to be so much nicer to you and you are expected to work harder to survive this. In these clinical rotations, you are supposed to take histories from the patients, you have to examine the patients, you have to go through the investigations, and you will have to go through the management plan also. Basically, you are expected to know everything about the patients. Otherwise, you will be making your consultant upset. They say that patients are the best books to learn medicine. So that is the objective of having clinical rotations. So don't fail to make maximum use out of it. Then there will be your final year. At this point, you would have finished most of the theory stuff of medicine. You will be doing clinical rotations called professorial appointments. These are certainly harder than the previous clinical rotations. You will be facing several assessments frequently, and these will be done under strict supervision. After you finish your professorial appointments, after a period of study vacation, you will be facing your final exams. This is called final MBBS exams. These exams have two components, clinical component and theory component. In the clinical component, you are going to be assessed in two ways, namely short cases and long cases, and in the theory part, there will be MCQs. So these will be done for 5 different subjects: medicine, surgery, pediatrics, obstetrics and gynecology, and psychiatry. This is a common exam in the sense all the medical students from all the medical schools of the country will be sitting for this. You will be ranked according to your scores. Even if you fail in a single component of a single subject, you will not be included in the ranking. You will have to sit for the repeat exams. If you pass these exams, you will be working as an intern house officer or intern medical doctor for 1 more year. This period is the most difficult part. There will be no flexible working hours, no proper vacations, and you will be hardly find any time to relax or to eat peacefully. But many graduates say that the process can feel hectic, but this is transformative. Once you finish your internship, you will obtain your medical license from your relevant authorities, which makes you eligible to practice as a doctor. After this, some people proceed with doing postgraduate studies, while some other will remain as MBBS doctors and work as medical officers. Both paths are cool in different ways, but I'm not going to be talking about this stuff in this particular video. I hope you found this video very informative to you. If you have any questions, please ask in the comment section and I will be happy to answer them. See you in the next video. Thank you very much.